Age is a very significant factor in fertility, and understanding how age might play a role will help you make more informed decisions about the choices that you have available for you. For women, that decline is more accelerated, especially after age 35. Both the quality and the quantity of eggs is going to decline pretty quickly. There are two factors that we tie to ovarian reserve. There's quantity and there's quality. The quantity of eggs goes down over time. A woman is born with all the eggs that she's gonna have, and she loses it over time. At the same time, the quality of those eggs will also go down, and quality is defined as the ability of an egg to be fertilized and grow into a baby, but also about the likelihood that that embryo is genetically normal. And as women age, the likelihood that an egg is genetically normal goes down. So if you put those two together, unfortunately, you're getting squeezed kind of from both sides. You have a lower number of eggs as you get older, and a smaller proportion of those eggs are genetically normal. And that's why it gets harder to get pregnant as a woman ages. And that's also why the likelihood of a miscarriage goes up and up as a woman ages. Unfortunately, there is no perfect test to know the total number, but we use 3 different ones to give us a sense of how your ovarian reserve is looking like compared to another woman of your age. The first one is AMH. So you can think of AMH as the bank. So the higher the number, the more eggs you have left. And we can compare that to other women your age and give you a sense of where you might stack up. The second one is FSH. This is a hormone that's made by the brain, and it talks to the ovaries and helps stimulate a follicle. And the third test is antral follicle count, and that tells us how many little eggs are we able to see in the surface of the ovary. As long as an egg is coming out, there's always a chance. But the likelihood of getting pregnant without assistance or naturally starts going down around 35 and then goes down more precipitously after 40. And after 45, it's quite rare. It's never 0, but after age 45, it gets very, very tricky to help people get pregnant with their own eggs. So we talk about options to use those eggs, but also options to use different approaches to help them build their family. So whether you're just starting your journey, getting more information, starting to explore your options, or you know you want to do this, the first step is to book a consultation. This is where we spend a lot of time with you, looking through your history, understanding what your goals are, what you're trying to accomplish, your medical history, and we talk about all of the options that are appropriate for you, any testing that we need to do to get more information, and we explain in detail how this process works from end to end, so you, plus your partner if you have one, can make an informed decision about the right next steps.